Yes, we are live now. Welcome, Dr. Ananya, to Varun Kapur's show. It is indeed my pleasure to host the show on behalf of Rotary Club of Addiction Prevention and Rotary Club of Mumbai Elite from Rotary District 3141, India. I'm very thankful to Varun Kapur for this platform, which he has built for more than 10 years. Dr. Ananya, and for the new viewers, what is the genesis of this series? When we lost Sushant Singh Rajput, it created a sort of tsunami of sorts. Everyone knew that he was drugged without his knowledge and gaslighted and finally extinguished from the face of this earth. For all of us, he was not just an actor. He was much more than that. He was a thinker, artist, and above all, a person who loved human beings, a philanthropist to the core. So a huge movement started not only just in India, but all over the world for justice for SSR. This brought us together. Then the menace of drugs became clear to us because we were going through his life history and everything. So many of us for this movement got into social media and we became active. Many of us became victims of cyberbullying. And then we decided that we have to really create Swachh Bharat, where people have awareness about the various kinds of addictions and we can create a clean, healthy habit, people with clean, healthy habits. So Varun Kapur is invested in this, and so the collaboration of Rotary Club of Mumbai Addiction Prevention and Rotary Club of Mumbai Elite started. So here we are here, Dr. Ananya. Uh, so thank you very much for agreeing to be on this show.
Thank you so much, ma'am, in fact, for having me on the show and the genesis that you explained for this entire series. Really hats off to you as well as Varunji, because high time we address these issues right straight away without mincing the words and without beating around the bush. So thank you for your dedication towards this cause.
Thank you so much, Dr. Nanya. Not only me, lots of people all over the world, they give so much of their time. Every day, there are at least 10, 12 channels talking about this. And in each of the channel, you will find 400, 500 people participating, contributing whatever they know and talking about it continuously. And in Twitter, it has been leading for more than 2 years. From the time he has passed away, he is the person who is topping the list. Justice for Sushant, justice for Sushant. It has been all the time there. Thank you very much for joining this show, because Sushant was dedicated to creating youth who are knowledgeable, who are dedicated to science, who want to develop themselves, who want to have clean habits. So that is why we are here. So viewers, let me introduce Dr. Ananya Chitale to you. So she is an MD in psychiatry from in the field of homeopathy from Dr. M.L. Cavale Homeopathic Institute, Palghar, Nashik. He has also done advanced diploma in yoga and Ayurveda from Tilak Maharashtra Vidyapeeth, Pune. And she has also done what is known as play therapy from Emoticons, India, that is from Aund, Pune. And then she has trained extensively in psychotherapics, which have established efficacy in addiction treatment, that is using CBT, DBT, that is cognitive behavioral therapy, dialectical behavioral therapy, and acceptance and committance therapy. So she has done from Beck's Institute of Cognitive Behavioral Therapy her course, and again behavioral technology USA under Marsha Lennon, and also PsychWare under Dr. Russ Harris, all experts in that field. So, and she has contributed a lot immensely to this area. For a long time, she has been working. So, welcome, Dr. Ananya. We are indeed proud to have you over here. So, just before we start the questions, is there anything in the back of mind that you want to start with?
Uh, well, yeah, I mean, firstly, thank you for the introduction. And at the back of the mind, I would really want to say that today my only objective will be to address in general what is the role of mental health in addiction in terms of whether mental health could be the key to unlock the preventive aspect of addiction as
Yeah.
well as for the treatment, though we might have discussed or we might be aware a bit, but
Yeah.
there also I would like to throw on important aspects of neuroscience, because unless and until we understand that, we won't be able to empathize with the whole scenario of addiction and an addict, that why it is so difficult, why it is not so straightforward, why we have to be there for them and not
Exactly.
just for like few days or few weeks. It is a journey of
Yeah.
probably long
Even he
years or
said,
even
he
lifetime.
promised that he will stop, and he went to a de-addiction center. Again, why has he gone back? So,
Yeah.
right, what is the issue exactly? We have got to understand that. Thank you so much for that. So, now you have done MD in psychiatry, extensively focused study on addiction, and that too right from the year 2012. So, at such a young age, what made you pick this specialty?
Yeah. So, to quickly tell you why first I picked up this specialty of psychiatry itself is because, many of the times I believe that all our life choices or career choices are highly dependent on our life experiences before we make a choice. And even in my case, I think my own life experiences with the close family members around me, or what I was seeing happening in my own family when it came to mental health, it really made me wonder that why we behave the way we behave, or why we think the way we think, or why we feel the way we feel. And why somebody is not able to cope up with all these mental health issues. So this was something that was triggered in me even before, maybe somewhere I was around 10 or 12 years of age. And to find answers to this, I was very clear that I want to enter into the field of psychology or psychiatry. So I
Yeah.
was very clear even in my 12 that I want to take up psychiatry, whether it is MBBS followed with psychiatry or BHMS followed by psychiatry, doesn't matter. After I got my admission into MD psychiatry, or even before that, in our all psychiatric postings during internship and stuff, I remember extensively my posting in Masina Hospital in Bhaikala, which has a very dedicated psychiatric unit. And I saw uh, I mean, so many physical illnesses, we always have better and better cures coming on a daily basis. But with
Yes.
mental health, I don't see that happening to that extent as it happens with physical illnesses. It is still a big query. We don't have satisfactory answers for many of the psychological issues, and we're still struggling with it big way. Now, since my admission in MD psychiatry, the area of Palghar, if you all might be aware of, the incidence and prevalence of alcohol addiction is enormously high.
Yeah. Very
Over.
true.
So in our OPDs, we used to get the patients day out,
Okay.
and I would say the same thing that you just mentioned. 3 days of admission for a fever, and they don't get alcohol. Fourth day, they'll end up into withdrawal states. They come under our department. We manage their withdrawal. Patient is fine. They say, "Abhi मैं life में कभी दारू को छूऊंगा नहीं," and within a month they are back on that.
Mhm.
So, with this, so much of incidence and prevalence, I was really wondering that, let me do something about this in my capacity as a MD resident or as a research fellow. I was a research fellow in the Department of Psychiatry in the Department of Research over there.
Mm.
So then, as a junior research fellow, I decided to take up the topic of understanding efficacy
Addiction.
of homeopathic medication in alcohol addiction and basically alcohol withdrawal symptoms. Because withdrawals, the kind of withdrawals that we were seeing, they were so horrendous, to be honest, that we used to literally 8, 10 people catch the patient and restrain him. He would be so violent and aggressive,
I-
and many times even allopathic psychiatric medications would fail to even settle that patient. So I was like, let me do something on that. And then I had this paper and I extensively happened to study that. And that's how my addiction related journey began from there.
Yeah.
And after that also, now since 8, 10 years of my practice, the area of interest that I've chosen, along with the previous speaker that we had, Dr. Kruti Trivedi over here, is the internet addiction. Because we all know 10, 15 years down ago, internet addiction, we
Not
never
good.
imagined that
Yeah.
this is something that we are going to get addicted to.
Yeah.
And the kind of patient that I'm seeing, adult, children, geriatric age group, my God, there is an
Very
amazing
high
number of
percentage.
exponentially increasing number of people who are addicted to some kind of internet or screen, or related to that. So
Very true.
yeah, that is how I started, and I'm continuing my work whatever way possible into the field of addiction.
Very interesting for a young person to understand. Thank you, Nipunji. You are always, you join. There is Patmaja, there is SSRFC. I can see people joining. Uh, Dr. Ananya, it was John Milton who said the mind is its own place. It can make a hell of heaven and a heaven of hell. So
True.
it's all the whatever happens between these two temples that can make things, imaginary look real, and what is real look imaginary, all those things. So how would you connect mental illness with addiction? Is there a connection at all? Mental
Yeah.
conditions and addiction, what are the factors that connect? Why would you say that they're connected, if at all?
Okay.
Yeah.
Okay. So
Mental
I
health and
think,
addiction.
yeah. So, to begin with, you open any research paper
Yeah.
and just type on the Google mental health or mental illness and addiction. Significant amount of connection has already been established via all the researches that have been published till date. That yes, there is the mental health or mental illness and addiction sort of go hand in hand. Now, why does that happen? In India, or rather globally also for that matter, even today, mental illnesses go underdiagnosed or undiagnosed. Okay, so mental illnesses or even small mental health issues, not even small, but basic psychological issues such as some anxiety, depressive states, or even clinical issues such as proper anxiety disorder or depressive disorder, all these things go underdiagnosed. It is not like physical illness, right? That we are aware that I'm
No,
having weakness, body ache.
I have something to say here. That is because most of the people, the moment you say I'm feeling depressed, then they will imagine the worst and they will think, oh,
Totally.
pagal to nahi ban rahi hai. वो पागल का नहीं doctor के पास जा रही है. That kind of a stigma was there earlier. Now it is
Absolutely.
slightly reducing, but I think that is the reason why so much has not developed, because mostly people are not subjecting themselves to clinical trials. They don't want to meet the doctors. They want to suppress. Even if there is a problem in the family, nobody wants to talk about it. So that is one thing. And second is, after all, physical ailments, it is easy to calibrate with certain instruments or something, but
Exactly.
you can't do that with the mental this thing unless the person discloses.
Exactly.
Right. So these are
Exactly.
the various things that occur to me. So how are
Totally.
they connected with that mental health and addictions? Yes. How have they proved that it is a
Yeah.
connection? There is.
So that, yeah. So as you rightly said, that they go underdiagnosed because of all these reasons, and just the fact that we don't realize that okay, I am having some issues and I need to visit a professional. I see it as कि हो जाएगा, ठीक है, I'll be fine. It's a phase, हो जाएगा. Most of us do that. Now, what happens is when you're already into psychological troubles, the chance that you get addicted to substance to find your calm or escape from those painful states, mental states, goes very high, because that's a very easy thing to do. Now, I'm talking here of substance, but that same is applicable even to things like behavioral addictions. When you're talking about gambling or internet addiction, pornography addiction, all these things are an easy way to escape from our own psychological issues or the psychological pain. And
Right.
that is why you will see that people who are addicted, many times they already are having some mental health issue at the background which has been unresolved. It could be PTSD, it could be a borderline personality disorder, it could be ADHD, it could be depression, anxiety, any of it, unresolved trauma, unresolved conflict, unresolved grief. All these are the what you can say, the prior things, the
Yeah.
pain which it cause, which these things cause, the person will resort to either substance or to screen. And
Correct.
that is why you find very high correlation of mental illnesses and addictions. Vice versa also happens, where a person might just start some addictive behavior or a substance just because of peer pressure, or just because chalo kuch try karke dekhte hain. There are no issues as such in the person's life,
Absolutely. Yeah.
just tries that. And
Correct.
then of course, because of the neurochemical changes that happen in the brain, the person tends to reuse it again and again, and that might lead to multiple problems. So that would lead to interpersonal issues, that would lead to isolation, that would lead to person losing interest in day-to-day activities,
Yeah.
creating more problems in his daily life, and that would further trigger proper depression, anxiety disorders, or any other
Yeah,
psychological
because
disorders.
people around them will feel irritated. They are not dependable. You
Exactly.
can't know that they will come, show up anywhere. They will do their job properly. Nothing, right? So that is
Exactly.
that could create a problem. I totally understand that. So actually, when you say that people, some of the people may have a mental issue, and so they start addiction. And what I also understand is some of the people get into addiction because of certain other extraneous factors, and then they become there is a neurological impact, and because of this they are not able to come out of it. Have I
Correct.
understood you correct?
Correct. And that triggers other mental health issues,
Right.
of course. So
Yes.
it is both way connected. It is both vice versa. And
Right.
apart from that, this is about mental illness. But then if we talk about mental health per se,
Mhm.
a person who is having problematic coping skills, or a person who is having certain psychological traits within him which
Mhm.
are maladaptive traits, those
Mhm.
people are also having higher chance of landing up into substance use and further addiction.
What do you mean by
Okay.
maladaptive traits? क्या होता
Yeah.
है?
Yeah. So
We do it in
firstly,
India
let me
also,
tell you.
because both ways the people are of India and abroad, both are there. So whichever is
Okay.
comfortable. Yeah.
Yeah. Okay. So, firstly, let me tell you what is a trait. So,
Ah.
trait is basically an enduring personality characteristic which will determine how a person behaves, thinks, and acts over various situations. Okay. So, for
Yes.
example, if somebody tells me, I am an irritable personality, that
Mm.
would mean that I tend to act in a very irritable way across various situations in my life. Not once or twice I get irritable, छोटी छोटी चीजों पे I'll get irritable. That makes somebody tell me that I have a irritable personality trait.
Mm.
Okay. So when I
Yeah.
say maladaptive coping strategy, so for example, मेरे जैसा मुझे चाहिए था
Mm.
मेरे लाइफ में, जो मैंने सोचा था, जिस करियर के मुकाम पे मैं पहुंचना चाहती थी, मैं वहां पे नहीं पहुंची.
Correct.
So, how would a person who is having maladaptive traits will say,
Mm.
कि I will get sad, I will get depressed, I will blame external factors for that,
Okay.
and that is not going to ease out the pain anyways. That is not solving the
Yeah.
problem. The
Correct.
pain is going to increase, and then I will want to get withdrawn from the society. I will find a quick fix, and that quick fix can. There are many quick fixes around us.
Right.
So a simple quick fix is this: go
Yeah.
on the social
Okay.
media and just check people's profiles or put something and get that validation which otherwise I'm not getting because I feel I'm not successful in my career, and
Right.
that's how the process of addiction starts.
Oh God.
Okay.
Exactly. Yes.
So a maladaptive trait can itself lead to, so being mentally healthy,
Mm.
rather being mentally well resolved,
Mm.
in a stable state of mind, in a resilient state of mind, is extremely crucial. If not, those people are again on high risk for addiction.
Got it. Yes. So, what are the person? What are the qualities that are intrinsic to a person? किसी का natural problem है, so because of that they are getting addicted. What are those things? The
Yeah.
internal. What are the internal traits? Vulnerability. How it increases because of the factors intrinsic to the person that develop addiction.
Yeah. So you're right. Actually, we can actually classify risk factors that increase the chance of anybody falling into addiction into two categories. The one, we are going to discuss just now, is the intrinsic, and the other is the extrinsic.
Yeah.
In intrinsic factors, mainly we can see it in three ways:
Mhm.
genetics, epigenetics, and uh, the individual personality and coping styles of
What is
stress or.
epigenetic? I don't know.
Yeah. So epigenetics, so we all know genetics. So, it's
Yes.
very clear that
फैमिली में
falana
किसी को है तो हमको आएगा,
identified
दैट्स व्हाट
है,
इट इज.
so there is a high chance. For example, breast cancer, we are no BRCA1 gene. Okay,
Right.
if that is present, 80% chance that the female
You'll
will
get.
get breast cancer.
Yeah.
So that way, not fully, but research has identified certain genes that are responsible for addictions. Not all though. Now, when we say epigenetics, means that gene hai, okay,
Yeah.
but whether that gene expresses itself, manifests itself, or remains silent, will
Yeah.
be determined by various other factors,
Correct.
the other external factors and internal factors. So that is epigenetics. Okay.
Okay.
So
Okay.
for example,
Mm.
hypothalamus, there is an axis in our brain that regulates certain hormonal secretion when there is a stress.
Yeah.
Okay. Now in some there is a gene which will regulate this part, but early childhood experiences, early trauma will see that the gene expresses itself fully.
Mm.
Okay. So
Correct.
epigenetics is where it does not change the gene, but
Mm.
some other processes inside the person's body which will facilitate the expression of that gene rather than the gene remaining silent. Okay.
Okay. Okay.
So that is what is epigenetics. Apart from that, I mentioned that the other very strong internal factor is the, as I already mentioned, psychological traits and coping strategies that a person has developed over a period of time, probably since early childhood.
Okay.
Okay.
Yeah.
So, for example, there is this one personality trait, as per the Big Five theory of personality, one personality trait called as neuroticism.
Yeah.
Okay. Now, all of us are people who will get anxious when there is a problem. ऐसे नहीं कि कोई भी कभी घबराता नहीं है ना. Stress
Mm.
आएगा, problem आएगा. जब COVID आया,
Mm.
everybody of us was scared.
Yeah.
People who are high on this particular trait of neuroticism
Mm.
will face extreme anxiety, panic. They will feel hopeless, helpless. They're always on the edge. They're extremely sensitive. Okay,
Mm.
so neuroticism is a trait which encompasses these qualities.
Right.
Higher is the neuroticism as a trait. Higher
Mm.
is the presence of that trait. More is the person going to be anxious, nervous, always on the edge. Okay, so people who are high on neuroticism have a higher chance of landing up into some kind of addiction. Girija ma'am, you're frozen on my screen. Are you able to hear me?
Keeps talking. Yes. Yes. Yeah. Even if you don't appear on the screen, just keep talking because it will
Okay,
sync it. Yes. Yeah.
okay.
Even if I
Similar.
disappear, you continue.
Okay, fine.
Yeah.
Okay.
Mm.
So neuroticism is one of the trait. The other trait is poor impulse control. Okay. Now, we all see children who are कि अभी का अभी मुझे चाहिए तो चाहिए ही मेरे को, नहीं तो
Yeah.
मैं तोड़ दूंगा फोड़ दूंगा कुछ भी करूंगा.
But
ये
there are
टॉय,
adults also like that.
adults also, but from most of the times if
Most
you
of the
see na,
people
yeah, this comes because in childhood a person was not taught how to control his impulses.
correct. When you
There
want
wasn't
something
immediate
immediately, it is
gratification.
fulfilled.
Correct.
Yeah.
Okay. So again, that's why I said that certain things should be worked. We will discuss more about that. But certain things, if we work right from childhood,
Mm.
the maladaptive coping skills that we were talking of will not continue in the adulthood, reducing their vulnerability towards
That
addiction.
we will discuss separately so that people will
Yeah,
focus on that because
exactly.
exactly. Yes. Yes.
Right.
So
So
these
poor
are the
impulse
internal
control.
factors. Yeah.
Poor impulse control, low self-esteem, as it is very much evident for youth or even anybody to develop social media addiction or screen addiction or gaming addiction.
Yeah.
Okay, then high risk taking behaviors. People, there are some inherent qualities in a person which propel them to take unweighed risk
Yeah.
in life.
Exactly. Yes.
Right, so that is another personality trait. So all these things, if they are present internal to a person, the
Yeah.
vulnerability towards addiction increases.
Okay. Yeah, exactly. So, there are people who won't take any risk at all, even calculated risk. And there are people who will just jump into anything without understanding this. So, both are actually difficult. So,
True.
those who don't take any risk at all, they probably don't have self esteem or confidence. And those
Yeah,
people also will get into this. And those who will take risks without even looking at what is the next step, just leap ahead without looking where they are leaping into, they also will get into this, right?
correct.
So
True.
amazing analysis. So what are the factors external to the person that are responsible for addiction? We discussed now अंदर से क्या क्या होते हैं. What are the reasons why externally that can make a person addicted?
Yeah. So again, a lot of researches, if you see, if we go through the life histories of many people who have developed addiction, you will see that many times these people have been subjected to various kinds of traumas, abuses in some point in their life which has been unresolved. And
Yeah.
that is extremely painful. When I'm talking of trauma and abuses, it can be horrendous, it can be horrible, and if it is unprocessed, the pain of that trauma is so much difficult for a person to bear that the person is pushed towards finding something which will numb him, his or her mind, or which will make forget him or her that trauma, even if it's for a while, doesn't matter. Okay, that painful the trauma can be.
It's the
So
memories
trauma,
that haunt them, you mean to say? The memory of the trauma?
totally, totally, unless and until it is resolved, again that increases risk
Somebody to
towards.
talk with, some counselor. People don't get access to all this. Sometimes they
Correct,
can't even tell the parents. That
correct,
also has happened.
totally.
Yes, yes.
That
Yeah.
has happened, right?
Yeah.
So these kind of environmental factors,
Hmm.
then again, very small things, the kind of upbringing, the kind of parenting. Another thing is the social learning theory. Okay,
Okay.
for example,
Hmm.
what is the social learning theory? So if I, throughout my life, I
Hmm.
have been seeing that whenever my people around me, say for example my father or my mother,
Hmm.
whenever they get stressed, they eat a lot. So I am going to learn that whenever I am stressed, the
Hmm.
only thing that can resolve my problem or make me feel better is eating. Same
Okay.
applies to alcohol consumption or smoking.
Hmm.
Okay, that whenever my father is stressed, I have seen him smoking, sitting alone and smoking. So probably that's the way to resolve the stress.
Hmm.
Okay, so social, that is what we call it, a social learning theory. We learn a lot through observation and imitation, not
Correct.
just in childhood but even throughout our life. We have seen this very common thing, right? उसने काम नहीं किया तो मैं क्यों करूं? We are
Yeah.
that picky. We pick up
Influenced by
from our
others.
environment. Exactly.
Yeah, exactly. Yeah.
Right, so that kind of a thing. Then apart from that, the kind of peer influences that the person will keep having throughout his life. Again, we have already seen in our past few webinars where peer influences mattered a big time, right?
Okay. Yeah.
So all these things are very much there, which are external to the person, who can
Yeah.
propel him towards addiction.
Also, here somebody had written that excess of money available with small children, that
True.
also can get them. And also, during the previous conversations with others people, they also said sometimes interaction with people of a bigger age, that is when you are a teenager, if you are sitting with adults, sometimes they are consuming and they will say kuch nahi hai, le lo, and they introduce
Ah,
it. So
true.
very often, instead of guiding them the right way, the elderly people introduce them to these things.
Correct, correct.
So,
Absolutely. And that is what happens. The area where I was working in Palghar,
mm,
another, yes, very important thing. Thank you. You reminded me about that. That there, consuming alcohol is a normal part of their life.
mm,
Okay, it is it is a part of their customs and traditions many times to consume
yeah,
alcohol. So again, if it is
both in
normal,
high societies as well as in the very low part
yeah,
of the ladder of the society, we find it is a custom. Like
it
in
is a
high
custom.
societies, for every small thing, they want to have a drink. Now, though, it has even seeped into middle class for birthdays, wedding anniversaries, everywhere you've got to celebrate with a drink only.
True,
Similarly, yeah, earlier it used to be like go to temple or buy new
true.
clothes or call the family and make kheer. Now वो सब नहीं चाहिए किसी को. Everybody
Yeah.
wants to have wine or champagne or alcohol or whatever. So that is what
Yeah.
is happening. Yeah.
So
So,
cultural influences, and again, we have discussed probably even in our previous webinars too, that the way the things are marketed outside, the people who
exactly.
support all these things and come in those ads and they show that
The
Manikchand and
movies,
all that
the
stuff,
advertisements, everything shows.
glamorizing that thing.
Yeah.
So all these things are continuously there, around us. It never goes away. So
Yeah,
even if it is
exactly.
not there in my family, it can be so much around me that I am some point of time, if I am also the person who is having low self-esteem, or if I am also the person who prefers, अगर मैं नहीं करूंगी तो मेरे लोग मुझे accept नहीं
Yeah,
करेंगे, friends accept नहीं
exactly.
करेंगे, तो let me go and do that
Yeah,
just for
have
one
it.
day. I fall under that trap.
Yeah. See, for graduation and all, earlier it used to be like go and do namaskar to the elders. Now, educate graduation, hai to you have to have champagne. So
True.
it is like that. So for any celebration, it has become like that, right? So
Absolutely.
yeah, and here in the Western culture, even when a person passes away, also they when the people come over, they are offering drinks. So it's really very culture to culture it is so different. And
True.
the media, the movies, the advertisements, they are bringing so much of the west to the east that we are copying, or not emulating, but just imitating many of the things which are not good
Yeah.
for us. And that is could be another reason also. So
True.
now, coming to the most important part of neuroscience, because you said that beyond a person's influence, what impacts a person is the neuroscience. Even if the person wants to give up, there is something that is happening there in his head which makes him go back again and again to that addictive substance. So, can you please explain that in elaborate? Because we have not covered it at all. Yes.
Yeah. Okay. Okay. I'll try to explain that. It is, while I was thinking about this, it is a pretty complex thing, but I will try to simplify for all of us. Okay.
Yes.
Uh, so let me just tell you a couple of things before I start with that proper part.
Yeah.
So if you have seen our brain, this
Mm,
part of my brain, we call
mm.
it the this frontal
Prefrontal.
part is prefrontal cortex,
Yeah.
PFC. We are going
Yeah.
to call it as, okay.
Yes. Yes.
Right in the middle of the brain, if you just cut this part and you see it from sideways, right there in the middle, that
Mm.
curve shape, if at all you have seen the brain,
Yeah.
somewhere there lies another important part of our brain, what we call it as limbic system, and some structures around that limbic system. Okay, these two are very important for us to know for today. Now, uh, the most important thing which we may have heard also a lot in when it comes when or talking about addiction or neuroscience addiction is the dopamine and the reward circuit. Okay, so this reward circuit lies somewhere in that middle part of the brain near that limbic system, nucleus accumbens, etc., etc. We'll not go into the technical terms. So it lies in the middle of the brain. Okay, this part of my brain, the prefrontal cortex, we call it as rational thinking brain, and the middle part of the brain, the limbic system that I was talking of, we call it as emotional brain. Okay,
Okay.
because all emotional chaos goes there,
Oh,
and this is my
the
monitor
rational thinking.
towards that,
Yeah.
yeah, chaos.
Okay.
Okay, so you name any rational aspect of us and it is concerned with this. So it could be logical thinking, reasoning,
Memory.
evaluation of a situation, making correct decisions, judgment, problem solving, making choices. Everything is about this. Okay,
Mm.
so it is like the monitor for that emotional chaos. Now,
Oh,
in that limbic system, what happens is there we always have a steady secretion of dopamine in a normal person. Okay,
right.
so that steady secretion is somewhere around 60 nanoliters, 60. Okay, so
Hmm. Okay.
morning when I wake up,
Mm.
I feel like going for my job, I feel like taking a bath, doing all my stuff. I'm pretty much normal. So
Yeah.
that at that point of time my dopamine is somewhere around 60 nanoliters.
Okay.
Some days when I feel low and I
Mm.
don't feel like getting up, chalo chutti maar dete hai, So that are the days where my dopamine secretion has gone down, somewhere maybe around 40 to 50. Okay.
Okay. Yeah.
Then one day comes where I get a promotion, I get a salary hike, my girlfriend or boyfriend says yes to me, everything is going right. So that is probably the best day of my
Yes.
life.
Yeah.
Okay, so I'm getting all those stimuli which are secreting dopamine, but the
Mm.
highest possible level on my best day of dopamine is around 100 nanoliters, right?
Okay. Mm.
So now just remember these figures that from our worst day in a normal person to the
From what
best day,
you can
the
go to
fluctuation of
600.
dopamine is between 40 to 100 around,
100. Yeah.
right?
Okay.
Now, when it comes to addictions, what happens is whenever you consume that substance or you take up that behavior, I'm talking about both here, the addictive behaviors in terms of gambling, internet, etc.,
Mm.
as well as the substance.
Mm.
Whenever you go there, whenever that comes in contact with you,
Mm.
uh, just I'll tell you the amount of dopamine rush that you just get by putting that one peg of alcohol
Mm.
is 1000 nanoliters.
Oh God. Okay. From
Okay,
100, it becomes 1,000.
on
So,
our best day, when we are feeling great, the amount of
yeah.
dopamine is 100.
Okay.
But with just that one peg or that one puff or whatever, our amount can, rather, this is true for the methamphetamine, okay, that
Mm.
the level will shoot up to 1000. And with alcohol and other drugs like nicotine and stuff, it still remains in around few hundreds, 400, 500, depends.
Mm.
Right? Now, just imagine
Mm.
अगर मेरे को ऑन माई बेस्ट डे व्हेन आई एम वर्किंग हार्ड, आई एम डूइंग गुड इन माई जॉब, आफ्टर दैट आई एम गेटिंग प्रमोशन, बहुत कुछ करने के बाद मेरे को कुछ मिलता है तो मेरा डोपामिन 100 तक जाता है. यहाँ पे मैं कुछ नहीं कर रही हूँ.
Hmm.
Okay, I'm just consuming something or watching something and I get that much of dopamine, right?
Correct.
What is going to happen?
Hmm.
That memory is going to get stored in my brain, right?
Okay.
Now, of that particular way, कि मैं ये remember always that anything that we do ना, भले
Hmm.
उसका अगर रिवॉर्ड मिलता है उसकी भी मेमोरी बनती है, अगर
Correct.
जो एक्शन हम लोग लेते हैं उसका अगर पनिशमेंट मिलता है या नेगेटिव कॉन्सिक्वेंस होता है उसकी भी मेमोरी बनती है अंदर.
Correct.
अगर
Yeah.
पनिशमेंट मिला तो वो बिहेवियर वापस ना करने का सुझाव मिलता है अपने को यहाँ से प्री फ्रंटल
Correct.
कॉर्टेक्स.
Yeah.
ओके,
हाँ.
बट अगर मेरे
So
को
enjoy
डोपामिन
that.
जैसे
हाँ.
रिवॉर्ड मिले
अच्छा लगा.
तो आई एम गोइंग टू रिजॉर्ट टू दैट. इट्स सेम ना कि अगर मेरे बॉस ने मेरे को बोला कि तूने बहुत अच्छा पीपीटी बनाया, कितने अच्छे एफर्ट्स है,
Again
नेक्स्ट
वापस
टाइम
करने का मन करता है. Yeah, you will
मेमोरी.
take up that assignment more. Yes. Yes.
Exactly. Same
Yeah.
is there. So the moment my brain understands कि इतना सारा dopamine मिला, तो I am going to remember what gave me that dopamine. Okay, that memory becomes encoded in a structure called as globus pallidus, which is important for formation of a behavior.
Okay.
Okay, it remembers that as well. Right now, if I remember that and that high, फिर मेरे को बच्चा हुआ या मेरे जॉब में हाइक मिला, अगर मेरे को उसका एक्सपीरियंस आया तो इसका एक्सपीरियंस मायने नहीं रखता है. वो 100 नैनोलीटर कुछ नहीं है फिर मेरे लिए. आई एम नॉट गोइंग टू फील हैप्पी विद दैट.
Yeah. You
That
don't.
is one thing that
Yeah, you
happens.
don't consider that happiness. You want that.
Consider,
Yeah.
because now my all my synapses are looking for 1,000 nanoliters of dopamine. उसको ही sensitize होंगे अभी क्योंकि उसने एक बार वो देख लिया.
Yeah.
Okay, so
Exactly.
my synapses are now changed.
Yes.
Okay, they will not identify that इतनू सा चुल्लू सा dopamine जो मुझे बाकी activities से मिल रहा था. Okay,
Correct.
that is one thing that the drugs or these things cause. The other thing simultaneously what they do to our brain is that they slowly impact this neurons and the synapses over this area, the prefrontal cortex, which
Oh.
is responsible for our all those rationality.
Yeah.
Okay,
Hmm.
so now what happens, ये इसका कंट्रोल धीरे धीरे कम हो रहा है. यहाँ पे पार्टी चालू है in the midbrain, in the middle area of the brain, in the limbic system and stuff. So
Yeah.
now this is slowly going out
Losing
and
its
that is taking complete
control.
control.
Oh God.
Okay, that is the stage of the first stage, what we call it as drinking, rather binging and intoxication ka stage. I am in that high, I will continue drinking and smoking or whatever it is because I am in that high. Now what happens, comes the second stage of withdrawal. Now till that substance I am consuming is in my body, party chalu hai in my middle brain. Okay,
Yeah.
the moment that substance goes, what happens, जितना स्पीड में मेरा डोपामिन आया था उतने ही ढाक से डोपामिन नीचे गिरेगा. Okay,
Hmm.
and
Yeah.
that goes at levels below 40 because of certain compensatory mechanisms that happen.
Hmm.
Okay,
Okay.
because
Hmm.
remember brain is not made for that surge, but वो आया है मुझको अच्छा लग रहा है, but then somewhere brain will compensate. तो जितना high आया था dopamine level
Yes, होता
उतने
है.
ही नीचे गिरेगा, and
Yeah.
that low could be as low as 10 nanoliters or 20 nanoliters.
Oh, and when electricity flows at very high, this thing, there the fuse blows, right? So,
Exactly.
absolutely.
Exactly.
Yeah.
So what is going to happen now, that low is as low as 10, 20 nanoliters. Remember on my worst rate was 40 nanoliters,
What?
जहाँ पे मुझे कुछ करने का ये नहीं, and I'm talking here of 10, 20 nanoliters of
Okay.
dopamine. So even getting out of my bed, even moving my limb, one limb becomes so difficult. I feel so low, so demotivated. I don't feel empty. I feel empty. I don't feel like doing anything. Now what the brain has identified कि अभी ये मैं कुछ नहीं कर पा रहा है ये बंदा,
Hmm.
there is a threat to his existence, there is a threat to survival. तो इसको जो चाहिए वो देना पड़ेगा. तो इसको क्या चाहिए, उसको वही सब्सटेंस चाहिए वापस वो डोपामिन लाने के लिए.
Those. Exactly.
Okay,
Yeah.
now with this process going on inside, what happens is वो डोपामिन जब that is the craving part what we are talking about. Okay,
Hmm.
you
Yeah.
know अभी वो चाहिए, अभी वो नहीं अगर मिला तो what happens, some other area called as amygdala gets activated because it senses कि कुछ तो problem हुआ है ये बंदे को. Okay,
Okay. Hmm.
तो सब्सटेंस नहीं मिला है, डोपामिन लो है, कुछ तो प्रॉब्लम हुआ है, amygdala is stimulated and it starts sending stress hormones. ओके,
Oh,
दैट इज द
okay.
फंक्शन ऑफ amygdala. कुछ भी गड़बड़ मेरे आसपास हुए, कुछ भी सर्वाइवल को प्रॉब्लम मेरे होने लगा, तो आई
Right.
विल स्टार्ट रिलीजिंग स्ट्रेस
Dopamine comes
हार्मोन.
here, and this stress hormones will increase also.
Now, stress hormones increase, and that lead to all kinds of psychological and physical
Is it
symptoms,
called
which are
cortisol?
distressing.
Is it
Yes,
cortisol? Okay.
yes, one
Okay.
of the hormone is cortisol.
Okay. Okay.
Okay. So now what happens? Now that is responsible for all those restlessness, irritability, all those psychological and physical symptoms that a person experiences when he doesn't get that substance. The
Okay.
withdrawal symptoms, what we call it as. Why
Yeah.
do we get that symptoms? Because amygdala ka na ek hi function hai. Whenever there's a problem, it will start secreting stress hormones, which prepare us to fight, flight, fright, or fawn. Only four
It's
responses.
required also, right? Sometimes
Required for
major,
survival.
yeah, it is required.
Whether
Otherwise,
you
we
fight
will
off,
never,
or you
yeah.
become afraid, anxious, nervous, or you freeze, or you become people pleasing, कुछ भी करो मेरे को ये चाहिए, मैं कुछ भी दे दूंगा लेकिन
You
कुछ.
will run
So
from a
that
situation, you will escape, you will try to take care of that situation. Little stress is okay, good,
yeah.
right? Yeah.
But with this kind
Too
of
much of it in
situation,
this
the
situation,
stress
it becomes
hormones
dangerous.
are, yeah, it becomes difficult, distressing. That is where withdrawal symptoms come. And once we see that survival is impossible, a person's behavior lands up to becoming a primal behavior.
Hmm.
Beg, borrow, steal, कुछ भी करेगा मेरे को survive होने के लिए ये चीज चाहिए तो चाहिए. I don't care.
Yeah,
Okay, as it is, we know this is lost. What
correct.
stops us from entering into these behaviors normally is our prefrontal cortex, which tells us कि नहीं ये नहीं करना है. कुछ भी हो जाए, this is wrong. You cannot hurt somebody, or you cannot stab somebody to get what you want. ये
Correct.
regulation कहाँ से आता है? यहाँ से आता है. But we know that the substance has already fired this part,
Okay. So that stops
prefrontal
working to
cortex.
the
So
extent it
that is
should.
not there. I am on a survival mode, and that kind of explains ki why we see these news that the son stabbed his mom because she did not allow him to play PUBG.
Yeah, exactly.
Okay, because a person becomes primal at that level. He
Right.
doesn't have any way to
It is not with his
understand
judgment he has done it, but
totally.
absolutely, yeah, totally.
Totally.
Yeah.
So that is what happens. And of course, then further, as the substance use continues, this gets completely off. Almost all the neurons and the neural connections, they all are into chaotic state. So it has lost its control on the entire emotional regulation, impulse control part. The more the substance continues, eventually what happens is there is one more substance called as glutamate. ओके,
Mm.
विच सीज टू इट दैट सब जगह पार्टी होनी चाहिए, सब जगह से डोपामीन का वो चाहिए मेरे को, तो इट एक्टिवेट्स ऑल, इट चेंजेस योर ब्रेन
Oh,
basically.
God. Mm.
Okay, such
Yeah.
that now all the connections in the brain are just concerned with the rewarding effect of dopamine, which is coming only from the substance or the behavior.
So until you give that substance, they don't let you be. They
And that is
demystify
that the
you.
addiction has developed. कुछ भी करो अभी substance के बिना कुछ होता ही नहीं. That is because of the glutamate part.
Right.
Okay, so
Yeah.
that is what happens. Now, why we were discussing this, when we are talking about recovery
Hmm.
or treatment of addiction. Now, this very simply I have explained, tried to explain. I don't know how successful I was, but there is extremely
You
intricate and
explained very
complex
beautifully.
level of neurotransmitters ka up and down, synapses ka up and down, inhibitory effect, and that is very, very complex and intricate. Plus, I said that the brain changes. So, if
Yeah.
I'm talking about re-establishing a healthier pattern or healthier behavior instead of substance abuse
Is it
behavior,
when you say the brain changes? Is there any test that shows the changes in the brain, like
yes,
X-ray
that
or?
is how they have found out. They have done functional MRIs and they have compared the healthy brain versus a brain of a person who lands up into substance abuse and addiction. And they have seen that when you give that substance, which areas of the brain get which areas light up. Okay,
Okay.
what is the so they have seen the prefrontal cortex of a normal person versus a prefrontal cortex of a addicted person.
Person.
It's very different in looking.
Okay. Okay.
Okay, so they have
Yeah.
actually seen those changes, and that
Yeah.
is how we are able to conclude
We are
that
able.
how addiction can actually uh,
Absolutely.
create chaos inside. And
Correct.
then when we're talking about recovery, imagine the amount of efforts and time that would be needed for
Yeah.
the entire reconnection to happen.
Yeah.
and go
We are
back
saying
to
why
normal.
person has to go and stay there for 3 months or 1 month क्यों करना है de-addiction के
Yeah,
लिए? Can he just not decide that I will stop and stop it? He always promises that he will do it and he's not doing it. All these kind of complaints come from families. When we
totally.
tell them that you have to go for de-addiction, शायद 1 महीना लगेगा, 2 महीना लगेगा, depends on the person. So we'll have to wait. They get very angry. क्यों? Why can't he decide? Why can't he respond? But this is the thing, like,
This is the thing.
yeah,
And just to add here one more thing, the age at which this happens also determines how intensely the problems are going to happen.
okay,
Suppose if the substance use and abuse starts at a very early age, 10 years, 12 years, 13 years,
mm,
the amount of problems that get created in the brain are way too intense because the brain is not developed.
yeah,
Our prefrontal cortex fully develops by the age of 18 to 20.
okay,
Okay, so
yeah,
after that, for a substance to impact it that way, it is little difficult for the substance क्योंकि
yeah,
कुछ connections already अच्छे से form हो गए हैं.
correct.
But in a
But it
developing
happens.
brain, it
Um,
will develop only in a problematic way if the
oh God.
substances go that way,
It may be very
right?
difficult to get them right.
Yeah,
Yeah, very, very tough situation. So that is why it's so very important to protect them during the teenage years and they become complete
totally,
adults because it becomes irreversible sometimes. The damage that you
totally,
see, it
totally.
will
It
become
can happen.
irreversible. Correct? Yeah. Because you explained it so beautifully. And I just want to also ask you that many patients will be complaining to you. Not many of them may be complaining first itself about addiction. They may say, I'm feeling depressed, I'm feeling sad. And then you may realize that they've got addiction. They may talk in the course of the time. And there are people who will come to you with addiction problem, and then you will realize probably they are having depression or what it is. So, how do you find out what came first? Again, hen theory jaisa, how do you find out? Or is it important to find out?
Yes, our first answer is very clear. Yes, it is very important to find out किसकी वजह से क्या है.
Ha.
Okay.
Okay.
I'll tell you this very commonly happens in behavioral addictions where
Hmm.
we don't completely understand ki is it because of the addiction that the person is going into depression or depression tha pehle se hai and addiction is a new problem which has come up.
Correct.
Okay. Why
Exactly.
in behavioral addictions? Because unlike substance addictions, behavioral addictions में ना physical symptoms उतनी जल्दी नहीं दिखते. Remember in the Kasat sir's lecture, he had mentioned about red flags at the
Yeah.
physical level that you see, the bloodshot eyes, tremors, etc.
Correct. Yeah.
Physical symptoms commonly come up comparatively early when we are talking about substance addictions as compared to, say, internet addiction or social media addiction.
Correct.
Okay. तो
Yeah.
वहाँ पे specifically when a person comes to me or a patient comes to me saying that I'm feeling very depressed, I can't focus on my work, I'm feeling empty, I'm hopeless. So the
Mm.
first thing that we ask is that we do take, not the first thing, but we do take in detail the case history in which we ask the history of any habits or
Mm.
addictions very clearly to the patient.
Mm.
Okay. Now
Yeah.
again, not everybody would say ki ha I am addicted, right? Not
Correct.
everybody
That's what
would say that.
we don't want to say.
Yeah, and that is where sometimes it takes for pay. We do always inquire and we do go indirectly. We are like detectives when we take cases of patients, always
Because
rather.
most people, even to their very well-known family, they won't accept. They won't accept that they are addicts. Family knows
Correct,
that okay, you have been doing this, you have been doing that. They will say, "No, no, no, ऐसा कुछ नहीं है. I
correct,
decided
correct.
to have it, so I had it." They will never admit that it is beyond their hands. That's it.
Correct, absolutely. That happens, and it becomes very difficult to identify. But what I have observed in my practice is that even if that is the case, we now, after years of experience, can say ki definitely there is some addiction, either substance or depending on the other signs and symptoms also of the
Right.
patient. Because
Mm.
when we take psychiatry in psychiatry, when we take cases, we also ask about daily routine. We do tend to take information from their primary
Exactly.
caretakers or their family members also, wherever it's consented by the patient, wherever it is relevant also.
Mm.
Teenagers, children, we definitely do that as it is.
Mm.
So from there, we do get many times idea that there is possibly addiction as well. Okay,
Yeah.
then of course, but because our goal is the treatment
Treatment.
and
Yeah.
not to moral police them or not to show them कि आप कैसे मुझसे झूठ बोल रहे थे,
Mm.
we do continue with the treatment first. Okay,
Yeah.
treatment in terms of psychotherapy, initial stages where we create that rapport, create that bond, where then the person many times feels comfortable to share ki, maybe I am having porn addiction, or I am using this particular substance. Okay, so that is one way that we do give them that space. Although we have directly identified, we may not always want to confront them right
Confront.
away.
Yeah.
Yeah,
But the idea is not to humiliate them. The idea is to
humiliate.
help them.
That is
Yes.
not the purpose or the
Exactly.
goal.
Yeah. So why do that?
Yeah.
That's very,
So we
very
never,
beautiful.
yeah,
Yeah.
confront, or, even if we find out, we always subtly say them that, maybe I think that your mobile screen time, which is there for 8 hours a day for the recreation, that might be impacting the way you're feeling, or you are having the problems right now. Do you think that we need to focus on that aspect?
Uh-huh.
So this way also we tend to slowly direct them towards a problem. Many times they don't want to hide, they just don't think that it is responsible for
Correct.
their issues,
Yeah.
right? Specifically again in behavioral addiction and substance,
Yeah.
so a lot of awareness has been created. They already know, but they are into denial कि नहीं
Yeah.
नहीं ये दारू के
Right.
वजह से नहीं, मैं इतना पीता ही नहीं हूँ डॉक्टर साहब, वो तो
Yeah.
कॉमन सेंटेंस होता ही
Exactly.
है.
Yeah. And even if
But
I
then,
take it, I take it with my voluntary this thing. They'll never say that there is so much of impulse. If I
true,
don't take it, I have that. They will not admit that is an issue,
true,
right?
true.
Yeah.
So
So,
that is how we tend to go ahead. And the moment we find out, of course, as I said, we give them space. Many times for them to just take them at the level of acknowledgement, ki, yes, there is this problem, might take many months of sessions, and we are okay with that,
yeah.
unless and until the person is going to major health issues. For example, alcohol addiction has, cirrhosis of liver has set in, or all those physical issues are compromising his life. There we have to straight away tell him and confront कि जब तक ये बंद नहीं करोगे तब तक कुछ नहीं होगा, ये दारू की वजह से ही है,
Mm.
and ये बंद करना ही है. You have to admit in IPD or get in the rehab, have your withdrawal detoxification done, and then we have to work on removing the addiction. So apart from these kind of scenarios, we might not directly go and jump into the confrontational mode.
Yeah. But in this stage, any of this time, does homeopathy medicine also helps?
Yeah. Okay.
Yeah,
So,
homeopathy.
yeah, definitely. As I said, I had done my research, and for the withdrawal stage, the research which I had done, it definitely had reduced the period of withdrawal with
Wow.
only homeopathic remedies, even in the severe cases of delirium tremens. Okay.
Okay.
So I would say that homeopathy has a good scope when it comes to management of withdrawal symptoms, and also it has good scope when it comes to urge or craving management. Okay,
Yeah.
but again, not on its own only. It is not a standalone therapy.
Mm.
When we are talking of urge management, craving management, and any kind of addiction, it has to go hand in hand with other aspects of psychotherapy as well.
Yeah.
But yes, there is definitely scope. Because here we are having viewers from all walks of life, I would like to say that never fall prey to some claims that सिर्फ homeopathy से ठीक होगा. Okay.
Mm.
I, being a homeopath, I'm telling it right out there. In my experience, no addiction will be treated only and only by homeopathy or by,
In medicine. Yeah.
any other system of medicine.
Correct.
It always has to be integrated approach, just for the fact that we have seen what are the risk factors and neuroscience. So to tackle all these, we need help from all possible other aspects. So homeopathy, wherever there is need for allopathic medications, there is need for psychotherapies, there is need for group therapies. Everything
It has
has
to
its
be an
own role.
integrated approach, and
Has
they
to be
cannot
integrated.
self-medicate themselves. किसी और को
No,
work किया, I can take this. They should not do that
no,
because
they
it
should
can be
never do
very
that.
dangerous, and they do not know what exactly are the precautions they need to take, looking at their own physical or mental state. So it is
Correct.
very, very important. Yeah.
Correct. And plus, I would add one more point. Whenever you're going for addiction का treatment, always check for evidences.
Mhm.
Okay?
Mm.
कि research ने क्या बोला है. It is okay if you want to believe on somebody and try something out because हाँ उसको काम किया, तो go to that expert, try that out. But when you're planning your addiction का recovery or treatment, always go evidence based. Check for researches, which new therapies. उसका सिर्फ case reports नहीं. Okay, you have to see whether it has been done, whether the treatment has been verified via clinical trials,
Mm.
okay, randomized control trials.
Mm.
Uske baad whether the intervention therapy has stood the test of all these levels of research. Okay, if not, ओनली एनेक्डोटल लेवल पे जाके कुछ ट्रायल एरर मत करो. ओनली यू आर वेस्टिंग योर टाइम, यू आर वेस्टिंग योर मनी, एंड एट द एंड ना व्हाट हैपेंस इज द एडिक्ट एज वेल एज द फैमिली फील्स चीटेड. दे फील
Exactly.
इतना कुछ किया, क्या फायदा हुआ, हम लोगों ने
Yeah,
ये किया वो किया ये किया. नो, इट इज अ वेरी सिस्टमैटिक वे व्हेन इट कम्स टू एडिक्शन. यहाँ वहां से कहाँ सुनी सुन के यहाँ वहां मत जाओ. गो टू प्रॉपर प्रोफेशनल्स, हैव अ प्रॉपर प्लान इन माइंड, have an integrated approach. Every system has role. I would say yoga, exercise, homeopathy, ayurveda, allopathy. Depending on case and its need, we have to integrate various modalities. That would be
absolutely.
the key. Yeah.
Yeah, yeah. Uh, Doctor, when people come to you, say for example, somebody comes with depression, says that I feel I'm no good in this world, I cannot achieve, I've done this, I'm a very poor self-image, etc. How do you understand if the person himself has developed it, or because of some mental abuse, somebody has been telling constantly that person you are no good, that gaslighting has happened? How would you ever come to know that?
Okay.
Yeah.
Uh, yeah, this is something very close to my heart, the topic of emotional abuse and gaslighting as well. So, how do we identify? Okay, I just want to ask one more thing. How do we identify in terms of like in general or as a professional? What are the signs? You want to
As
know
a
that
well,
first?
I- as a general person, like how do I know if
Okay.
I know that somebody says some maybe a student comes and tells me that
Hmm.
I don't feel like studying, ma'am. What is the use? I cannot achieve anything in my life. There are students who come and tell me that I'm a girl and my father says there is nothing that I can do, and I feel like committing suicide. Those kind of things happen, and then when they say that my father has been saying this, you know that there has been emotional abuse. But some of them
Hmm.
don't even say that. They only say that I feel very low. मुझे कभी भी कुछ करने का मन नहीं कर रहा है. So is it their own hormone? Is it their own depression? Or is it because of somebody else's? How do we find out? Ordinary
Yeah.
people. Because many of them, we are not able to bring them to psychologists or counselors.
Yeah.
So
Okay.
are there any symptoms we can identify?
Okay. So, more than symptoms, I would say that they're not symptoms. What you have to do with that person as a layman, if you encounter somebody,
Hmm.
sit with that person, try to understand since when did all these symptoms start. It could be symptoms of depression, anxiety, or any other emotional symptoms.
Hmm.
Okay.
Yeah.
Ask the person since when you are feeling that way. Since what after what happens, or is there any trigger usually that happens around you that makes you feel that way? Okay.
Right. Hmm.
Who are the people around you? What kind of relationships you have with your family members? Okay,
Hmm.
because gaslighting as a phenomena is
Hmm.
not just between partners or husband and wife
Yeah.
or partners with romantic relationship. It is at workplace. It can be done even by parents for that
Yes.
matter. So it is important
It
that you
need
sit
not
with
be
that
that both
person.
people are addicts also. Without addiction, also this
Absolutely.
can happen. Yeah.
Absolutely. And addicts many times do use this technique of manipulation.
Hmm.
Yes, so what you have to do is if you suspect that a person is going through gaslighting, sit with them and inquire about the interpersonal relationships that they have with their near and dear ones.
Hmm.
And try to ask them the nature of those relationships, that how well do you bond, how what do they think about you, how do you perceive them, what is the kind of feeling that you have for them.
Hmm.
Try to ask all these questions. That will give you hints that whether there is some person around that this particular probable victim of gaslighting who is actually creating or abusing him emotionally or verbally or whichever way. Okay,
Yeah.
that is one thing.
Mhm.
Second thing is that if somebody tells you, or you know that person for long, okay, it could be anybody, and then you suddenly see that a person is suddenly going aloof. Okay, पहले फोन
Withdrawing.
करते थे, उठाती थी, अच्छे से बात करती थी. अभी now the person doesn't want to talk, or even if the person talks, it talks in small short sentences or words, or says नहीं अभी नहीं बात करना है, बाद में बात करते हैं, I
Hmm.
can't talk just now. Or suddenly leaves his or her job, says that nahi
Yes.
nahi, I'm happy.
Yeah.
Suddenly there is a marked shift into the personality where you see that the prior confidence, prior way of communication, the way the person was with people around him, everything has changed. Okay, that
Exactly.
is one thing that should make you suspect that whether there is somebody who is emotionally, verbally, or physically abusing the person. Okay,
Exactly. Yeah.
so these are two important things that you
Withdraw
can
from their regular circles. You mean to
totally,
say? Yeah. So they are
Yeah,
not available. So people cannot notice the difference. Also, those who knew them before won't know at all how this
yeah,
person has changed. Or the only thing that they see is the person is not available for them, not
yeah.
contacting them. So
Not
that
contact.
is the red flag. Yeah, exactly.
Yes, and one more, which is a very indirect red flag, could be that when there is such kind of a person, a
Mhm.
probable victim,
Mhm.
and because the person is not reachable, because the person is changed, and you try to talk with somebody who's in immediate contact with that person,
Hmm.
and that person says कि नहीं पता नहीं क्या हो रहा है, नहीं उसका ना आजकल दिमाग खराब ही रहता है, whatever, but they don't let you connect with that person no matter what.
Wonderful. Yeah. Okay. Okay. They don't let you contact
They
that person.
don't
So
let you contact you say कि मैं एक बार बात करके देखती हूँ, मुझे अच्छे से जानता है या जानती है, मे बी आई कैन हेल्प हिम आउट, एंड जैसे नहीं वो
they are
तेरे से
manipulating the person's contacts. Yeah.
yeah. Yeah, they're manipulating, or they will frame stories, or give some narratives, and they will just stop you, or they will not let you enter. You will sense that. No, कि
Yeah.
अरे ये क्यों मुझे मना कर रही है, मना कर रहा है उसको मिलने से, वाई मैं तो इतने करीबी दोस्त हूँ इसके, एंड वाई ही इज नॉट अलाउिंग मी, एंड
Hmm.
ही सेज कि उसको ही मिलना नहीं है, लेकिन हमारा तो कुछ झगड़ा नहीं हुआ है, देन शी कांट बी दिस, सो यू ऑल्सो नो दैट देर इज समथिंग रॉन्ग. So it is
Yeah.
high chance that probably, again, probably, that
Hmm.
person itself is a perpetrator, could be a high chance.
Correct. Yeah.
Okay, because normally people who care for that person and the
कि
person is going to
मेरे से
depression,
नहीं
they
हुआ
say,
तो उनसे तो होने
whatever,
दो.
से हो
Exactly.
जाएगा, कुछ तो देखो, कुछ तो
कैसा भी
करो.
solution निकल जाए. Yeah. You
Exactly, they
say,
themselves will come and tell you कि अरे इसका देखना, ये मेरा तो सुनती नहीं है, तेरा सुनती है क्या, देख क्या हुआ है देख. No,
yeah.
they will not try to this thing.
Seclude
So
the
yeah,
person. Yeah.
these are two
You
three things
somehow
which.
want to get a solution, make the person feel happy, worthy of himself. So when you segregate the person, keep the person aloof, then that is a big red flag. Yeah.
Yeah.
Very true. And is it is it like a person? I have always seen that there are many people who came here who said that when a person is in addiction, he does abuse the others, right?
Possible,
Who are there,
yes.
possible. And at the same time, I also want to ask you, is it possible the other way? Say, for example, if a person is an addict, then can the other person around them make them feel what they are not doing, worth, like changing their drugs and all that, and make them feel like, that they are not worthy, or make them feel low about themselves, make them feel depressed? Is it possible?
Very much possible. Very much possible.
Mm,
To the extent that somebody who is into addiction deep down,
mm,
okay,
mm. Yeah.
and there could be people around him who could manipulate the narratives told to this particular addict person,
Mm.
or they can always make him feel that how he is invalid, or how he or she is good for nothing, and how they are, taking care of him, and they are compromising, they are sacrificing. Of course
Yeah.
they might be, but they will make that person feel it every now and then. Okay,
Yeah.
putting him even more under some kind of obligation, some kind of depression, etc.
Yeah.
They start living in that god complex, and they put that god complex onto this particular person who's addict. Now what happens is, many times addict, as we already said, this part is already damaged, it's fired, the prefrontal cortex. That is always necessary for us to understand कि सामने वाला मुझे मैनिपुलेट कर रहा है क्या, मेरे बारे में कुछ उल्टा सीधा सोच रहा है क्या, या मेरे साथ कुछ उल्टी सीधी चीज करने की सोच रहा है क्या, is he treating me well, is he really sacrificing, or is he just showing me that he is sacrificing. Okay,
Yeah.
I might be an addict, but am I really that good for nothing as much as he or she is portraying? ये सब
कोई
समझने की
जजमेंट
very
नहीं होता है.
context है ही नहीं.
Exactly. Yeah.
Right, so
So we heard in the case of Sushant Singh Rajput that even without the knowledge of the person, in tea and coffee and all, drugs are given, and then the person is sleeping for days. And when he gets up, he feels so lost. क्या हुआ मैं इतना दिन क्या कर रहा था? And then
true.
the people say, "Oh, you are depressed. That is why you're doing it." And again, making them feel, "Oh, you are having this disorder, that disorder," and giving him medicines which he was not aware how he should take it. So one after the other, one thing led to the other. It was a vicious cycle.
Yeah.
That's what we heard. So how we must, how can we warn people who are into say addiction, how they have to, how they are exposed to this danger also? So they have to be more careful around people, who to trust, what to trust, and they have to safeguard themselves, because sometimes your money, your entire life is in their hands.
True. And plus, somebody who might not be an addict, but a gaslighter, can push them into addiction indirectly. As you said, that manipulating stuff, narrative, building narratives, nahi nahi ye tere achhe ke liye hai, to putting them on some pills or the other, and the person can get addicted to those pills
Oh,
indirectly also. So,
okay.
gaslighting as a phenomena itself is complex, and it can worsen an addict's problem, as well as it can push a normal person into state of insanity, to addiction, or to any other psychological issues.
That's what. So physically, if say if a person doesn't have a problem, we can't, give them a medicine and make them sick like that. Somebody is not diabetic, you can't give them a medicine to make them diabetic. Somebody doesn't have blood pressure, but this is the problem with mental health, that there can be medicines that can be given to a person, or that can be given to a person, and the mental health can be affected. That is the most dangerous part of it. Something which is unseen, but you can't see what is mental health. You can't show it is here on this part of the body, but that is all over you, and that is what is making you feel who you are. Your action, your behavior, your thinking, your feeling, everything is controlled by that mental health. And
True.
that mental health can be influenced by somebody else with their medicine. That is so very dangerous, that it can be manipulated. So young people need to understand about the relationships, that they have to be very clear, that people can get them into these things. So that awareness is so very important. So you said it so very beautifully. So is a psychiatrist legally allowed to prescribe medicines without meeting and examining the patient? Because now you said that they can give medicine and then make them feel like that, get them, like, addicted.
Yeah.
So without, the person doesn't ask. Sometimes if I'm already addicted to something in small doses, I may not. When my partner says ye le lo tere liye acha hai, I don't even ask the question ki kon diya, why are
क्या
you
है?
giving it to me? Yeah, I'm just trusting the person and I'm taking it. And that
Correct.
person may tell others it is prescribed by a psychiatrist, but a psychiatrist has not seen me at all. So can a psychiatrist give like that?
So, ideally, if I am a psychiatrist, I have not seen the patient even once.
Hmm.
I don't know the person who has come to me, who is that person of that particular said patient. I
Hmm.
have no idea of the family background. I have no clue. Just because किसी का रिलेटिव आया मेरे पास और उसने बोला कि डॉक्टर साहब ये मेरे वाइफ को इश्यूज है, ये एंजाइटी में जाती है, उसको मेडिसिन दो, I will never give that. It is not allowed.
Yeah.
Okay. One should not do that. It is not ethically also right. Okay. As a psychiatrist, or as a homeopathic psychiatrist or allopathic psychiatrist, the first thing that we are supposed to say is ki, at least once I need to see the patient.
Yeah. Talk
Okay.
to the
With
patient.
COVID, yes, I have to see the patient, I have to talk to the patient, and then I will decide whether the medicine needs to be given in a covered form or directly with the consent of the patient. Because there are some situations where I need to give medicines in covered form. For example, schizophrenias, or for example, dementias, where a person, the patient has completely lost his ability to take judgment, to take decisions because of the disease condition itself,
Yeah.
right? Or
Correct.
in severe cases of withdrawal, as I said, delirium tremens, तो मेरे को वहाँ पे forcefully medicine देना ही है.
Correct.
Okay, because and that is where a guardian or somebody from the relative takes up the responsibility. We do all the legal documentation for that, taking their consent that we are administering medications, we're admitting in the hospital forcefully, or in a covert way administering the medications, or whichever way. So that is the procedure that we
So it's
need to
all,
follow.
there is a formal procedure for it.
There is a proper protocol, there has to be a proper procedure done, and without seeing patient even for once, without knowing who is the patient and who is this person who has come to me asking for medications,
Hmm.
we are not supposed to write down the medications
Register.
directly and give away.
Wow. Okay. Now, will a person who had no history of any depression before becoming an addict by himself or herself begin to believe that he is bipolar, he has got depression on it by himself, or because somebody else tells him that? How is it, like emotional abuse की वजह से होता है, क्या खुद ही सोचने लगता है कि मुझे ऐसा प्रॉब्लम है?
So you are saying who has no history of prior depression,
हाँ,
right?
प्रायर डिप्रेशन नहीं है, मगर आफ्टर एडिक्शन विल बिगिन टू थिंक मेरे को एडिक्शन डिप्रेशन है, इसलिए मैं आई एम टेकिंग ड्रिंक्स, विल बिगिन टू थिंक लाइक दैट?
Uh, Okay, so I would say that addiction मेरे को depression है तो मैं drinks लेता हूँ. Sorry, can you just repeat the question? I'm sorry for that.
I mean to say that a person who had no history of any depression
हाँ.
before becoming an addict, okay, will he believe that he is bipolar or he has got
Okay.
depression?
Got
Uh,
it. Okay.
yeah.
So, ideally, no,
Okay.
because when you're addicted
Mm.
and when you don't get that substance, you are going to actually go through symptoms of depressive states and anxiety and other things. Okay.
Mm.
I
Yeah.
am really going to feel sad, hopeless, empty, or maybe very
But you're
restless,
not getting it.
anxious,
Yeah.
panic. So I'm not believing it, I'm actually getting it. So I
Yes.
will say that I am feeling panicky, I am feeling depressed.
Yeah.
Okay.
Correct.
But now with the advent of Google and stuff, what happens many times patients tend to Google their symptoms.
Hmm.
Okay.
Okay.
For
Yeah.
example, abhi I am into internet addiction. Suppose I am the patient. I am into internet addiction. Now
Hmm.
I don't think internet से कुछ problem है मेरे को. Okay.
Hmm.
भले मैं 10 घंटा internet पे हूँ.
Yeah.
I start feeling hopeless. I feel empty. I don't feel like getting up. Lack of motivation. I Google my symptoms. It will say you are having major depressive disorder. I will start believing हाँ मेरे को major, and I'll go to the doctor saying doctor मेरे को depression है.
Correct.
Okay. So this can happen very much also,
Yeah.
specifically in behavioral addictions where you don't see that this particular behavior is causing me to feel depressed, because nobody will think कि एक घंटा गेम खेला मैंने तो
Hmm.
why I should feel depressed.
Yeah. Okay.
Okay.
Yeah.
So that can happen. That's where person can Google and just talk with somebody, and then somebody, हाँ तेरे को depression हो सकता है, तू जा मिल psychiatrist or whatever. Okay.
Correct.
So there are both ways. When you're addicted, you actually do get those symptoms. So
Yeah.
you might not really just make it in your mind. You're actually going through that, but attaching label to ourselves can happen because of the extra information that comes from WhatsApp University or Google University. So that labeling part, which ideally they should not do, that can happen, but not that they don't get symptoms, they might be really getting symptoms.
Yeah. So they think it is normal. They are having depression. They won't connect it with the drugs or the
They won't connect it
medicine.
with
They won't
drugs.
connect it.
Yeah.
They will say, "I'm feeling this because I have depression." But what
Depression.
is it? What is the difference between depression, bipolar? Because somebody says, "Oh, he is bipolar." What is that?
Okay. Okay. So if you talk about proper psychiatric diagnosis, uh, we have a group of disorders which are related to the mood of
Hmm.
ours. Okay. In that, we have two things. One is unipolar depression. That is, I feel only depressed. I'm at one pole of continuous low mood, hopelessness,
Yeah.
helplessness, worthlessness. That is unipolar, because
Yeah.
I'm continuously in that pole only of that lowness.
Yeah.
Bipolar is where I fluctuate between that intense,
Happiness and
hopelessness, worthlessness, and sadness.
hmm.
And after few days, I am at the state of not happiness but euphoria or
Okay.
mania.
Hmm.
Okay, I am exhilarated. I am on the top of the world to an extent that I don't sleep for 4 days at stretch.
Oh God.
Okay, I
Yeah.
don't feel like eating. I don't feel hungry. I am so much exhilarated.
Okay.
Okay, so that state, that clinical condition, we call it as bipolar.
Bipolar. Okay.
Right?
Can they become violent also?
Yes, yes.
Okay.
When
They
you are
can.
talking of mania, it is not a good state of happiness. Okay,
Okay.
that ha, I'm super duper. It's not that way. When you are talking of that extreme state, that includes agitation, increased agitation, aggression, violence. It can lead to that. That
Okay.
intense mania could be.
Yeah.
So
Okay.
from doing nothing to wanting to do anything and every damn thing.
Yeah. Got it. So you explained how relatives and friends can identify if a person is gaslighted. You can see that the person is moving away from the friend circle. He is not communicating with them. His behavior is different, and all that, right? So we had also several speakers who came here, and they said that emotional trauma. Okay, an addict can cause emotional trauma and can be the physical abuser, and at the same time, an addict also can be emotionally abused. Both
Yeah,
we saw here, right?
yeah.
So how can parents, teachers, and organizations play a part here to prevent addiction?
Yes, yes. There is this beautiful quote by Franklin Douglas, which says that it is easier to it is easier to build stronger children than to repair broken men. Okay, and that's what we had just touched it a little bit at the start of today's talk.
Yeah.
Is that what role parents, teachers, or the society can do is catch them young, start at a very young age, and as young as they're 2 or 3 years of old, to build those healthy psychological traits, healthy coping mechanisms in children. Okay, that will significantly reduce not just vulnerability to addiction, but possibly vulnerability to many mental disorders.
Okay.
Okay,
Hmm.
so the role of parents and teachers in organization, if anybody out there is listening today who is in a position to make policy changes, I am of the opinion, very strong opinion, along with my other colleagues in the fraternity, that mental health should be added as a subject in our schools. Okay, we have physical fitness, we have sports, we have a bacchus, we have, I don't know, my son is in first standard, and I see so many goddamn subjects that are introduced and formally taught to the children. Why can't we teach formally the psychological coping skills to the children right from start? I
Absolutely.
have seen children as young as 3 and 4 years of age entering into bullying. Okay, they bully others, they literally bully others, they tease others.
Yeah.
That, if that continues, we are looking at somebody who is going to have problems in impulse control, anger management, stress management, and they are going to be prone to addictions tomorrow.
Right.
Okay,
So
so
when parents say or teachers say, it will not have so much impact as when it is a formal
it
system that
has to
is
be a
taking.
formal education, right?
Yeah.
And when we're talking about brain changing in addiction, just imagine if the right connections are so well formed, so strong, a substance will not have a chance to, change those already consolidated healthy connections inside.
Correct.
Okay, rather it comes down to the first choice. There was an interesting study made between they had literally compared users versus non-users of
Hmm.
substances. Okay,
Yeah.
and we're still struggling to find out what are the protective factors. We've identified risk factors.
Yeah.
Two siblings in same family, one lands up into addiction, one doesn't, and
Hmm.
it comes right from the point where a person has those couple of drinks, but he decides not to choose further.
Yeah.
So it boils down to that very small aspect of continue making that choice and continuing with the choice of any substance or any behavior which can be addictive. Now, what is the difference? So what they found in that research is that the person who did not continue the use, he
Hmm.
said that it is because of my personal values.
Oh, so nice. Huh?
Okay,
Hmm.
personal values. Now, what are those personal values? That is still under research. Okay,
Yeah.
so he
Okay.
said, I just don't like the taste, I have better tasting things in my life, I
Yeah.
don't want that taste anymore. Okay,
Exactly. Yeah.
this, I don't get any high from here, I already get high from my music.
Yeah. Exactly. I have heard many people say this. Yes.
Yeah,
Yeah.
right, so
Yeah.
let others drink, I don't want. And sometimes it is just because I am so confident and I am so much having that self assured thing that this is wrong, this is not worth it, and I will not go for it, no matter the peer pressure, no matter status symbol, no matter any crisis in my
Yeah,
life. Just
exactly.
a strong
And we are
value
okay
of
with it.
that,
Yes. Yes.
right?
Absolutely. Absolutely.
So, if we can do that, that organizations, parents, teachers actively teach coping skills. I see parents going behind the children ki maths क्यों नहीं अच्छे से आ रहा है. Why can't we go behind the children and say कि why are you not able to manage your emotions? Let me teach that also to you.
Yeah. Why do you get angry like this? Or why do you go cry for long hours? Or why do
Yeah,
you like to sit alone in your room? Why are you playing for such a long time your digital this thing? So these are the things that parents should be focusing on. Right?
correct,
Yeah,
correct.
absolutely. So that needs to be definitely an important skill that parents and teachers and organizations have to pay attention to the mental health of the employees. You also talked to me about psychometric testing that can be used to understand if a person is intrinsically prone to addiction. So if organizations can conduct the test and do something about it, give them some psychological or maybe some sort of sessions where they can strengthen themselves, will it not?
Develop those skills, yeah,
Yeah.
or work on those traits. which can
Exactly.
make them prone to addiction. Yeah,
Yeah,
totally. That is
that would
quite much needed, because I
really.
think few risk factors have been very much identified in terms of, as we discuss, impulse control, sensation seeking behaviors, risk taking behaviors, and that can be assessed from psychometric tests. Right.
Yes.
So if your employees are, some of the employees are higher on that, not that they will certainly get addicted, but there is a chance,
Possibility is there.
possibility. And why
Possibility.
not cut that possibility right in the bud itself? No, why
Right.
wait till the problem actually escalates and then it becomes a tough recovery?
Right. And many boys and girls are employed from the campus directly at the age of, say, 22, 23, and all that.
True,
So,
true.
right then, there, if it is conducted, and then they are introduced to positive addiction, like you talked about positive addiction when we were talking, then probably they will be able to divert themselves from it. So, talk a little, doctor, about positive addiction.
Absolutely. So,
Yeah.
yes, positive addictions are extremely crucial. Again, coming back to early development of positive addictions, if somebody has already known the high that they can get from dance, music, art, all these things, very less chance that they will be waiting or driven towards the other high from the substances. Okay, that
Right.
is in the prevention. Second is, even in the recovery period, when we're talking about craving management, urge management, somewhere to regulate those dopamine reward circuits, we need to teach. I have came across people who have been so intellectually driven throughout their life, so career oriented, that they never nurtured their passions and hobbies, and now they're into addiction and they don't know what else to do. So we had to teach them, or we had to explore them, that see whether this gives you, it might not give you 1,000 nanoliters of dopamine, but now that your substance is stopped, you are into a withdrawal state, or you're out of withdrawal state, and now there is craving again and again to go for that 1,000 liter from 10 nanoliters that you are right now. Maybe, pursuing your hobby or passion as a therapy can give you at least 60 nanoliters, which
Yeah.
is what we aim
Be
at. We
better.
want to regulate that, the things that have gone up haywire,
Yeah.
right? So that is where developing a
Powerful
positive,
passion. Very
yeah,
powerful passion could be help.
powerful passion,
Yeah.
right? And eventually it will start giving that high. ऐसे नहीं है कि permanently ये गया तो गया, ऐसा नहीं है,
Yeah.
right? It is just a little
Rewiring has to take place.
rewiring. It's all
Yeah.
about rewiring and
Yes. Deep
setting that
mindset.
dopamine ka ye barabar se, dopamine
Correct.
meter, if I want to say that,
Yeah.
right? So all kinds of positive addictions, but let us not forget there are addictions that we talk about and there are addictions that we don't talk about. Now, exercise, for that matter,
Mm.
is seen as a very positive thing, right? But I have had a client who had exercise addiction,
Okay.
okay, to an
Mm.
extent that his entire personal life is disrupted because of his exercise habit.
Okay.
No matter what, he had to do his 2 hours of workout, to an extent that lockdown में जब भी COVID था and all gyms were closed, they were not allowed. He went on illegally to get access of the gym on a daily basis
Wow.
because he had to do it. His
No,
wife was
addiction is something that doesn't allow you to have a sense of priority and
correct.
makes you do
Totally.
things which are not, which you normally will not do, which is not healthy for you or for your family. So maybe
Correct.
illegal, maybe right. So anything, it can become an addiction. Even reading a book. That I have seen that there are people who will put the mobile light on and then they will read the book at night because
Ah,
there is a, or they'll put the bed sheet inside above them and then they are reading the book with the
reading.
this light. So it's
True.
so dangerous, and then their eyes are watering in the morning, right?
True.
And after all, I was only reading books. Why don't my parents allow that? I had to return that book tomorrow. But why don't you go and ask permission in the library and extend it for a week if you did not? But that is what is important. So a
Correct.
very important family event is there, and you say no, 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 because you want to party with your friends, you are not attending, and you know that event is never going to come back again, and that person is important to your life, but still you have done it, and then later you regret. So these are the situations which tell you that I have got into addiction.
Yeah.
It can be anything.
Exactly.
So yeah,
Exactly.
yeah. So it can be like you said, food. It can be playing a game. So some guest has come, some person, some very important relative has come, a friend has come who has helped you in your life, and he's sitting right in the hall, and then you're playing inside and playing games, and you don't even come to say hi.
True.
This also I've seen, right?
True.
So all this is addiction. Whatever prevents you from doing something that is constructive, which values a relationship, which you cuts off from people, I would say is addiction.
Correct. Absolutely. Absolutely.
Yeah.
So balance is the key.
Balance is the key. Absolutely, absolutely. We had a very beautiful discussion, and there are some things that this person Nipun has been posting. He always posts a lot of things about drug addiction. I will just read them out to you, and if there is anything
Sure.
that you would like to talk about it, so that because I don't want him to go with any wrong indication.
Yeah.
So, yeah. So he has written that 3 days back we admitted our friend in the addiction center for codeine misuse. What is codeine? What is codeine?
So codeine is usually available in cough syrups and all. People do get addicted to that. It is a opium derivative.
Oh, okay, okay. Then he has written that craving and body pain is the problem. Very difficult to fight the pain. Is
Yeah.
it? Oh,
Yes,
okay,
yes. It
okay.
absolutely is. And not just this, as I said, in at least in alcohol withdrawal that I've seen very closely, very severe withdrawals. They
Mhm.
have even convulsions, the epileptic attacks. They
Yeah,
have that. They are having hallucinations. They are into nausea, vomiting, and that is very severe, by the way. It's quite bad. So, yes, it is difficult to fight the pain. And that is what, now, that is so distressing that the person wants to go back to the substance.
exactly, exactly. So family doesn't understand, or friends don't understand, and they will say, "Why is he doing it?"
Yeah.
So euphoria is the reason person starts, later becomes slave of the drug.
True. In some cases, it is euphoria just to get the high. Some cases, it is a real need to escape intense pain.
Yeah. Okay. Recreational drugs has no relation with mental illness. It is done for enjoyment. Do you agree? I think even
No, not
drugs, because they're
really.
easily available. So
Yeah.
even yeah, you can do it even for mental pain because that is available for you easily.
Absolutely.
Right?
Yes. I mean, recreational drugs is done for enjoyment, but why would one do that? Because some they start because अरे मेरे सब friends कर रहे हैं तो मैं try करता हूँ. And
Yeah.
then they realize कि yeah, okay, I get that high, I want that high. Right, so again there is an issue of self-esteem, there is an issue of wanting validation from peer groups. So there are deep-rooted psychological issues why even the person makes that first choice many times, if not
Exactly.
obvious trauma or obvious pain.
Exactly. Yeah. So extra money with teenagers and young people is helping them to buy recreational drugs. People especially go to to Bulana and HP to
Marijuana.
buy first grade marijuana.
Marijuana.
I also this is okay, fine. Where it is available, you are sharing here. Okay. I just wanted to also say that in professional circles, there is a different kind of a pressure, which I came to know from my son. He says, like, you work in an organization, and then they will say, "Oh, you are doing so well, this," and they will give you an assignment and everything. And then people all go for a smoke break, and you don't join that smoke break because you are not smoking, and then they'll
Yeah.
come back and say you are taken off that assignment, somebody else is put there just because you're not with them in that group. So sometimes you get feel like, oh, I'm losing out on the opportunities, and you begin to join. So it will be very strong to understand that you cannot give into that kind of pressures.
Yeah,
So that is
yeah,
the
totally.
thing.
Totally.
Yeah,
So that thing doesn't come in a day. That
yeah,
has to start very, even for the fact the money, the thing which Nipunji mentioned, ki there is extra money and children buy and it's available. Again, that is related to the kind of upbringing. You may have a lot of money, but not everybody will go into that if they
exactly.
understand correct decision making, they understand responsibility. Now, all these things
Yeah,
should start from early childhood.
yeah, exactly. The red eyes marijuana is so famous that you find Israelis and Russians living there in large numbers for this weed. Okay.
Oh, okay.
Yeah. Then fine glassware bongs are sold there in normal shops for weed lovers. Police know everything, but they say nothing as majority populations are foreigners. Okay. He
Okay.
seems to know a lot
I'm
about
sure.
bongs.
Yeah,
Yeah.
totally.
Yeah. I can't take even very small amount of opium quality as my body can't metabolize it, while others take it in huge quantity as their genes allow them to metabolize it. Wow.
Very
Okay.
important, actually, Nipunji. Thank you for making this point because the way everybody's addiction looks and the recovery from addiction depends on definitely how much everybody's body is different. So how much everybody can metabolize, how long does the drug stay in their body? In
With such
that
a
also it
small amount of
depends.
alcohol getting
True, exactly.
yeah. And some people
Exactly.
take 3 or 4 bottles and then they are
And they are
yeah,
fine. They
fine.
don't get that high, or they are not intoxicated or inebriated for that matter. So it
Exactly.
highly depends on individual's physical constitution as well, not just the mental makeup.
Okay. Okay. So just stop the inflow of drugs. Simple. Addicts come out of this addiction, but it is available easily, then forget it. But that is for the governments to take action and decide it, right? It's so very difficult uh, for individuals. We can't stop it. If it is available, it is
Yeah.
available.
Deserve. And plus, I think when I'm talking about recovery from addiction, I'm not looking at one incidence where a person's drug access is stopped and then the person comes out of addiction. I am looking, when I say recovery, I mean that no matter even if the substance is there around me, I have developed those mechanisms within me
I
where
don't
I
feel
don't
drawn towards it.
land up again going towards it. So
Yeah.
that actually would mean coming out of addiction for me forever.
Very true. Even if it is just sitting, it is there next to you, and nobody is supervising it. Still, you don't take it. Nobody
Correct.
is
And that
watching.
also, by the way, is thanks to our neuroscience and the brain.
Yeah,
Even the cues, the brain remembers,
yeah.
right? कि, अच्छा
Mm.
हाँ मैं यहाँ गई थी तो अल्कोहल मिला था या whatever and I had got that high. So next time when I even goes to a place similar to that kind,
Mm.
I my all
Mm.
circuits get activated.
Wow.
And that's where even I might be sober but I might still fall back again in the trap. Then I would not say that the person has come out of addiction in real sense. So
Yeah.
our goal as mental health professionals is to see that it's not just coming out of that withdrawal state and then becoming sober for a few days. If there is still craving, if the person is finding it difficult to manage the craving, I won't say the case is over yet.
But we do say, that keep the person away from the environment which has been giving him that high, right? Giving
Yeah.
him the temptation. But how long can you do that?
Exactly. And that might be true for substance abuse. What about internet? What about social media? What about phones?
Yeah.
There, so our goal is never to keep them away forever from
You
phones or
can't do that.
screen.
Yeah, absolutely.
You can never do that.
Never do that.
Right? So our goal is to see that even if there is a screen, I am no more addicted to it.
Yeah. I don't feel the joy of being looking at that screen, and I find joy in other things, right?
True.
Yeah. So, this is another comment he has made. I haven't seen anybody taking drugs because of sadness or trauma. It taken for euphoria, whole Punjab. So, this, I wouldn't say that. There are people who do
Uh,
for both,
yeah,
right?
yeah. Actually, there are. That's why I said it is taken for euphoria, no doubt. But many times, at the core, there are patients who are having really difficult times in coping up with their painful emotions or traumatic emotions. And if there is somebody or there by chance will land up in the drug, then yes, of course, they feel that sense of pleasure, benumbing for some time, and they land up. So I would also sort of disagree because many patients we have seen where there is a lot of trauma at the background, and
Yeah,
it starts from there.
right. So even Nihang Sikhs openly use marijuana. Nobody says anything to them because of their military attire and lifestyle,
Okay.
possible. And then even you find that there are some, people who look holy and they wear that kind of clothes and they are using certain country drugs or something like that. So that is also, we see that alcohol is part of the custom in some parts of the nation, as she had discussed. Yes, Padmajadi, thank you so much. You always appreciate so much to learn, and very informative session. She's a
Thank you.
regular and she appreciates all the time. I'm sharing a myth. People in Punjab give opium to a person who got heart stroke or paralysis. They say it saves a person as it dilutes the blood.
Oh my God.
Oh God. So it's very, very dangerous. So thank you, Judy, Charlotte. Thank you all for joining, Paddy. Yes, thank you so much. Such an informative session and learning so many new things. And Judy has shared that watching your cell phone throughout, even during sleeping, is a big addiction.
Totally, totally, Judy, Ji, very true. Many of us don't even realize that we are probably already addicted to mobile phones.
Correct. If you have a small break, even if you get up from sleep, there is that inclination to look at, okay, kuch message hai kya?
Second.
If it is
True.
something urgent, people would have called you. They know that you're sleeping. So still, why do you
Yeah.
look at that, right? But
Yeah.
that happens. Yes, yes. I've seen families sitting at a restaurant and all their heads are on the phones instead of interacting with the family members. Absolutely true, Judy.
Very
Yes.
true.
And then you're talking with people who are not there with you. And again, when you are with them, you'll be talking with family. So that is a
Yeah,
sad,
irony, bad
that is
irony.
an irony. You know, you are most alone when you are least alone.
True,
That is
true.
what physically you're with people, but still you are alone. That is the thing. Like, very true, Paddy. Not only for teenagers, but grown up, the society on the whole needs to be aware of it. That is very true because all these gadgets have come to us. Even internet has come to us so suddenly, and whether
Yeah,
it is email or whether we nobody taught us the etiquettes, nobody told us how good it is, how bad it is. So we were suddenly introduced it, and everybody looked at it as a mere mode of convenience, and that is how it started. I can write a message now and the next minute I can reach you. It will reach you.
yeah,
I don't have to post a letter and it will not take 4 days. I can call you and next minute I can speak with you. I can see you on video. So that started giving a high, and then people have made it a habit, like. So very
true.
true. If we That's why sometimes I feel, if we were to charge WhatsApp, then to half the messages people keep on forwarding, they won't do it. So,
So true.
yeah, yeah, absolutely. So, thank you so much, Padmaja ji. Thank you so much. You bring such wonderful sessions. Thank you, Ananya ji, for your time and sharing your
Thank
knowledge with
you.
all of us. Thank you so much. Thank you, Ananya. Is there anything that you would like to say as a closing shot? Thank you so much for joining.
Yes, just a quick
Roundup. Yeah.
thought. Yeah. Is that maybe after today's session it might seem अरे neuroscience है इतना कुछ difficult है, but at the end I would just like to quote something that was said by Viktor Frankl. Viktor Frankl was an Austrian psychiatrist who was in Auschwitz concentration camps of Nazi times, and he saw his wife dying, saw his father dying in those concentration camps right in front of his eyes, and he himself was a psychiatrist. After he somehow survived the Nazi concentration camps, and after that he wrote a wonderful book, Man's Search of His Meaning. I think it's a must read book for everybody.
Yeah.
And there he had said one beautiful sentence which says that between any stimulus and response there is a space,
Yeah.
and in between that space lies our power to choose the right, and that's where our power for freedom lies. Right?
Absolutely.
So, no matter how much ever negative stimuli could be around in terms of traumas and conflicts, or there could be stimuli which drag us saying that mere paas I'll give you 1,000 nanoliters of dopamine, it still can be our choice whether we want to go for that or whether we want to go for something much healthier. Well, sometimes we do make wrong choices, but that doesn't mean that we have screwed up our life forever. We can always come back. And I think the very personification of the whole statement made by Viktor Frankl was seen via Prakash Mahajan sir's story or Vijay sir's story.
Yeah.
Everybody who had shared their past experiences in the previous session,
Absolutely.
that they
They
had
didn't give up.
initially some choices which were unhealthy, but then when they decided and when they chose, they could make right choices and get back their lives on track, no matter kitna bhi dangerous ho, neuroscience ho, ye ho wo ho, but still there is always a hope.
Absolutely, absolutely. So never give up, never say die until we die. As long as
So
we are alive, there is hope. So keep working at it and understand what is good for yourself and make the right choices. And there are friends and family who care for you. So be with them and try to understand and come out of the situation. There is expert advice available here. If any of you need any help, please write to us. We will connect you with the right person. So Rotary Club of Mumbai addiction prevention is there for you, and they recommend the experts. So please do get back to us if any of you need help, and do not think that if you write to us it will be made public. Nothing is going to be made public. So if any of your friends, any of your family members need help, please refer to us, because we want to create a world where people are aware that this is one opportunity and they can be the best of version of themselves, and this addiction is not going to allow them to be that. So this is our humble request to all of you. Please share this with everybody. Share with young people, they need not be addicts. It's not like we have to share only with addicts. People who could get addicts, or they may know somebody who's getting into a problem. So share it with everybody whom you know. Whoever will find it useful will find it useful. So thank you, VP, for thanking us, and thank you, Padmaja, Judy, Siddharth ji. Thank you for joining. He's appreciating you. Yes, Siddharth Udeshi is.
Thank you so much, everybody, for
Yeah.
being there.
Yeah. Thank you so much. We'll end the session. And again, next week, we'll meet you with an expert. Thank you.
Bye bye, everybody. Take care.
Bye. Thank you, Varun. Thank you so much. Thank you, viewers. Thank you, my dear friends. Yes, we have taken 1.5 hours, but it is every minute of it was worth it. Yes.
Thank you. Thank you so much.